I would have been honoured to contribute to the debate today in support of the NMA's petition signed by over 27,000 people. However, the government gagged the debate and I wasn't able to, so I'm going to deliver it in this room now. The conversation about aged care has taken a turn. The conversation has become all about access and availability of aged care, which is undoubtedly problematic, but the concept of quality is as equally important. And sadly, quality appears to have dropped off the radar in so many sectors. If we offer aged care places without quality care, we may as well walk away from our responsibilities now. Community expectation, as reflected in the thousands of people who have signed this petition, is that there should be registered nurses employed 24/7 in aged care facilities. Community expectation is not unfounded and misguided. It is based on lived experience, on our moral obligations and our sense of social responsibility. For these reasons, the community's voice should not be ignored and our laws should reflect the weight of opinion. As can be evidenced from the thousands of names on this petition, the weight of opinion firmly rests in favour of ensuring there is a level of quality in nursing homes and aged care facilities in New South Wales. In my former life as a health lawyer, I have seen terrible cases of neglect in aged care settings, where a pressure ulcer has led to a painful and premature death, where dementia was mismanaged, pain was left untreated, so-called antisocial behaviours were punished, and ultimately the cause of death was dehydration and malnutrition. These are just some examples of terrible situations that have occurred in aged care facilities with the current legal regime in place. If we are going to reduce the quality of care that aged care providers are required to deliver, then I genuinely fear what's ahead. As a society, we have a responsibility to ensure that people living in nursing homes and aged care facilities, our most frail and aged, receive the support and services that they need to live with dignity and respect. This can only be achieved if residents' health issues are adequately and appropriately managed. What we need is the clinical expertise and experience of registered nurses to be there for us at all times of the day in aged care facilities. I congratulate the Nurses and Midwives Association for its advocacy on this issue and bring to the attention of this Parliament the voices of so many people. And finally, I thank each and every one of the over 27,000 people who have taken the time to sign this petition, and I urge this government to listen to all of those voices and to retain the legal requirement for registered nurses 24/7 in aged care.